Hey fam, welcome back. Hopefully you're doing good and having a great day. If you're not, please let me know what I can do to help you. Until then, we have a video from Medical Secrets. This video was sent to me yesterday from a family of ours on the channel here, and that's actually Dan. And Dan is the one who joined us a couple days ago for a live stream because he was talking about the SGB injection. And that's exactly what we're talking about today here in the video, so let's go ahead and get into it.
I'm Dr. Anthony Cave, and that's my internal carotid artery right next to my internal jugular vein. Watch it get big. And right next to it is a bundle of nerves that controls how I get triggered, both emotionally and physically. That bundle of nerves is called the stellate ganglion. It's what makes your heart rate and blood pressure go up, your palms get sweaty, your pupils to dilate. It sounds like a panic attack or a PTSD flashback.
There's something else to that as well. When you have a reaction like this, you are in a heightened emotional state. I'm sure he's about to get into it, but it's the fight or flight instinct, right? You become super alert. You become super aggressive in some situations. Yes, the palms are sweaty, but you start shaking as well, and that's you are always scanning what's going on around you. You become super aware, but also super jumpy as well. And so, the reason why a lot of people really hate PTSD is because it makes them do things that they otherwise wouldn't normally do in much lax situations. I'll give you an example of this. When Sky was attacked by another dog, not once but twice, my heart rate instantly shot through the roof. I became immediately aggressive. I got extremely violent. I'm just a very protective guy. Anything that has anything to do with what I care about comes under any kind of threat. I am going to meet that threat with the utmost aggression to stop the threat. But especially when my PTSD is triggered, that is amplified by 100. And so when it came to this dog, I made sure that that dog knew what she was doing was absolutely wrong. And every time that dog has seen Sky and I in the yard, that dog hasn't even once tried to come into the yard. And so protectiveness and aggression really does get the job done. But in certain situations, you have to keep a calm and level head. And when you have PTSD, it is incredibly hard to keep a level head. Believe me, I know, but it can be done.
You can deactivate those nerves, literally blocking them with medications that dentists use to block the nerves that go to your teeth, like Novocaine, and you can provide profound and rapid symptom relief in patients struggling with PTSD and panic. This is the stellate ganglion block, and you see me doing it on a patient here. It's been used for about 100 years, and you're going to learn how it works, why it pairs so effectively with IV ketamine therapy, why you look like this afterwards, and what the side effects are. Let's start with how we do the stellate ganglion block. If you remember from the ultrasound, the internal carotid artery is right on top of the stellate ganglion. So 100 years ago, doctors would actually tug aside the carotid artery and put a needle through the front of the neck to numb the stellate ganglion. Later on, with the advent of X-rays, we were able to better visualize where we deposit that local anesthetic medication, and nowadays we use the ultrasound to better visualize the nerves and the blood vessels and go from the side of the neck to safely and effectively numb the stellate ganglion. With every technological advancement, the stellate ganglion block has become safer and more effective because we can visualize where those nerves are living and where we're injecting that Novocaine-like medication. That numbing medication only sits around in your body for a couple of hours, but the symptom relief can last much longer. We'll talk about that in just a minute. You can see me with the patient.
And that's really the thing with at least what I hear from a lot of veterans is that it's super effective, way more effective than any other medication that is out there for PTSD treatment. what truly disappoints me the most is that it's so difficult for veterans to get this treatment here. I find that to be absolutely heartbreaking. There are so many veterans that could benefit from this so much. I mean, even because this isn't just about veterans too, but this is, I'm obviously I'm just talking about veterans because I am one. But there are so many people out there that that could really benefit from getting this injection, and unfortunately, the VA makes it super hard for veterans to get it. Listen, if you are considering any kind of medication with the VA or any kind of medication from medical doctors or whatnot, I would definitely do your research. I'm not giving you any kind of medical advice because obviously I'm not a professional. But what I will say is that someone who has been through the usage of medication when it comes to PTSD, it's either I'm super alert and way more aggressive than what I even would have been in heightened situations, or I was an absolute zombie and wanting to sleep all the time. That doesn't help at all. So I would definitely at least take a look into this because I've heard so much. I've heard so many good things about it. We'll keep going.
Here as I scan the right side of her neck. We typically start by blocking the right side of the neck because most patients find relief by blocking the right side. In some patients, we'll then block the left side a couple days later. Once I've identified the right levels to inject on the stellate ganglion, you'll see on the left side of that screen my needle going to that site. The tremendous advantage of ultrasound is that I can visualize the other nerves in the area and the blood vessels to minimize the risk of traumatizing them as we block the stellate ganglion. This is why the ultrasound has made this procedure so much safer and faster. Once I numb these nerves, the patient will begin to feel the effects within just a couple of hours, even if the PTSD has lasted for years. Next, how does the stellate ganglion block work? The human brain learns when something new happens, whether you're reading a book or doing a science experiment. When the brain gets used to a habitual response, it gets ingrained deeper and deeper, whether it's a slot machine, a shot of whiskey, a cigarette, or even invoking your body's fear response over and over again to the same triggers. Your body's fear response is reinforced every time it is triggered. And as this happens over time, your body gets used to responding to triggers in the same way. This is caused by your sympathetic nervous system, that fight-flight response that releases a surge of adrenaline or noradrenaline every time you get triggered. And if you can break that response, even for a brief period of time, your brain can now learn that there is a different way of responding to those triggers. We call this neuroplasticity, literally rewiring nerves in your brain, showing that there are different ways of thinking, different ways of responding to those triggers that once stimulated your sympathetic nervous system so strongly. Because now, when your body is exposed to that trigger, but the fight-flight response is attenuated or weakened because we've blocked the nerves in the stellate ganglion, the mind-body connection can be reset. IV ketamine also promotes a powerful neuroplasticity that can synergistically combine with the stellate ganglion block, so your mind and body can learn new ways to respond to those triggers.
I wonder what this could do for addiction as well. That's something that I'm thinking about. Because if this works so well for rewiring of the brain, I wonder if that could also help addicts. Because yeah, he touched on it with with alcohol, and so that's what made me think about addiction. Maybe whether it's pornography, drugs, thrill seeking, because that can become an addiction too. I wonder what this treatment. I don't understand why this isn't more mainstream. I mean, well, because it's an actual solution. That's probably why. Because hospitals really don't want to help you. They don't want to heal you, right? They want you to keep coming back because that's how they make money. So that makes sense. And that needs to be changed. That needs to be big pharma needs to be done away with. We need to bring hospitals back to where they were before and actually committing to helping, saving, and healing people. We look back at COVID and we see exactly how the hospitals, how healthcare really treated people. I do remember that people who were going to the ER who did not get the COVID vaccination were not treated as the same priority as those who did. And I find that incredibly disappointing. I mean, that right there should be considered a crime because that's negligence. So that has to change, and this really needs to be mainstream. So, guys, please help me to push this message so that more people, not just veterans, more people can get this information. This is really making a difference. I saw the difference in Dan. I saw the difference. And so if this really helps, as it seems to be doing, then we need to get as much attention on this as possible. And we need to push for laws and policies to make this more accessible for people who really need it. And so I greatly appreciate the help, guys.
Many videos on IV ketamine, you can see them in the link below. The stellate ganglion block, or SGB for short, and ketamine sound like miracles, right? That's not true. They are not a panacea. They're not a magic bullet. The only magic, if you will, that comes out of this experience is that it can help uncover your inner healing potential. That healing potential is often blocked after years and years of betrayed trust, of trauma, either emotional or physical. And these therapies help reset your mind and body so that your innate healing capacity can be accessed again. And that healing capacity doesn't need medications as often as it might have needed before. It doesn't have the same side effects. This healing potential is uncovered when your body learns new ways to respond to these old triggers. And that is why the benefits of the SGB and IV ketamine can last months and years, long after the medications have circulated out of your body. And therapy during that window of relief from the sympathetic nervous system can fundamentally change your relationship with those triggers so that you have more mastery over them and them less over you. Put another way, water pressure builds up behind a dam, like when you repress and suppress past memories or traumas, allowing the water pressure to rise higher and higher. Raising the dam to temporarily keep back the waves of trauma simply raises that water pressure. Therapy with SGB and IV ketamine can actually lower the water pressure behind the dam to address the root causes of trauma that may have built up over months, years, or even decades. If you're struggling with depression, anxiety, PTSD, addiction, or even chronic pain, you deserve to re-access your inner healing potential. Patients have come to Claris Health with me in San Francisco from all over the world. And when we help them restore access to their innate healing capacity, they find lifelong learning, often without the risks of taking oral medications every day for the rest of their lives. And if you're learning something new, please hit that like button, subscribe, and share what you're learning with others. And consider joining my exclusive access group, where you can join our private Zoom streams to ask me your more personalized questions live. Click the link below and leave a comment if
Okay,
you've been
because
working to
I
heal from
was
PTSD.
I was wondering about some of the side effects, so we're about to get into this.
And share what's worked and what hasn't worked for you. Now let's move on to talk about the side effects of the stellate ganglion block. The most important side effect is Horner's syndrome. It's the physical effects of blocking the sympathetic nervous system. So we expect these effects. They only last a few hours, and they include a droopy eyelid, a constricted pupil, a stuffy nose, and a warm arm, warm hands, and warm fingers on the side that we blocked. And this should make sense to you because the sympathetic nervous system constricts blood vessels and makes them smaller. So when we block the sympathetic nervous system, it makes the blood vessels dilate. When they dilate in your nose, it can cause congestion and a stuffy nose. When they dilate in your arms, it allows more blood to reach your hand and your fingers, and they will warm up. And these are the other reasons why we use the stellate ganglion block. Like in patients with Raynaud's syndrome, when they have icy cold hands and fingers, Blocking the stellate ganglion will allow them to warm up again. Or in patients with complex regional pain syndrome, whose pain is heavily mediated by the sympathetic nervous system, and blocking the sympathetic nervous system can help profoundly decrease their pain. Blocking the stellate ganglion can also block the nerves nearby it, like the vagus nerve, the recurrent laryngeal nerve, and the brachial plexus. The brachial plexus are the nerves that go into your arm to help give you sensation and motor function of your extremity. If the Novocaine-like medication reaches these nerves, it can cause hoarseness, it can cause an elevated heart rate and blood pressure, and it may even cause a little bit of weakness in that arm. Once again, though, these side effects are typically transient and only last a couple of hours if they occur. Nerve injury is always a theoretical complication with any nerve block, and you need to let your doctor know if you have any pre-existing nerve problems or neuropathies, or if you have any heart problems because of those temporary side effects that can affect your cardiovascular system. I hope you learned something new about the stellate ganglion block and IV ketamine therapy. If
All right. Well, guys, if you want to go ahead and head over to Medical Secrets, subscribe, and watch the full video, I'll link it down in the description below. Let's read some of the comments. Let's not forget that PTSD is not always the fight or flight response or sympathetic nervous system activation. For a lot of us, it is the freeze response or getting stuck in the parasympathetic system. Would this method still help in this case? It sounds more like it would prevent fight or flight outbursts in PTSD rather than get someone out of a disassociation and freeze. Well, let's see what he says. This is very well said. The studies about SGB document significant improvement in validated PTSD score systems. And we find that it addresses both fight, flight, and freeze in our patients. That's something that I was actually thinking of as well, because not only do you have a fight or flight response, you also have a freeze response. I firmly advocate for strong therapy and sometimes ketamine therapy wrapping around SGB to optimally address the root cause. Thank you everyone for your comments. Okay, that's good. I'm diagnosed with PTSD and have been to therapists specialized on traumas. It takes a lot of work to change the trauma response patterns in the brain, and luckily my brain is capable for the change. This injection here seems to make the change happen faster. I'm grateful to you, doctor, sharing this with the world. As long as I don't have access to that injection, I will keep changing my brain slowly through therapy and inner healing. That is the thing with any kind of treatment. Do not lean on it. You have to do the work within yourself to change. It's a coping mechanism. And so if you're leaning on it like any other external coping mechanism, you're looking for something else to help heal you. But for the internal, you're going within yourself to help heal. And this is exactly why external coping mechanisms never work. That's why I always tell you guys, look, if you want to heal from depression, anxiety, PTSD, look within yourself. Find something within yourself that you can bring out of you that calms you, that gives you a sense of pride, a sense of accomplishment. And in turn, as you are rewiring your brain to deal with conflicts in different ways, you do begin to heal from it slowly but surely. Now, for such things like for veterans who have been through a lot of the things that they had in their service, whether combat or not, I don't think that those symptoms will ever go away. But you can work to manage them, and you have to do the work. You absolutely have to do the work. You cannot rely on medication alone to get you through any problems that you're having. And so I wanted to mention that because I think it really needs to be said. They call it PTSI now, post traumatic stress injury. It's not a disorder, but an injury to the sympathetic nervous system. That's interesting. Is that really what it's called now? I had an SGB done a couple of weeks ago for PTSD and anxiety prior to open heart surgery. I have complications of deep, pervasive pain in my upper body. I've been in ER 4 times in 8 days. Wow. Oh, bless your heart. However, my PTSD and anxiety are gone. That's great. Congrats. I now have a specialized pain doctor, and he's working back and forth between the ER and his expertise to extinguish the new pain systems. The pain has been really intense, but I've had absolutely no PTSD or anxiety. Thanks so much for introducing me to the SGB. I know the pain will heal as it's beginning to subside at this point, little by little. My doctor said my reaction was very rare. At this point, I'm not certain if I'd have another, but the possibility is still on the table if necessary. Maybe there is something that could be done preemptively. All right, we'll read one more. I'm doing both of these. I can't tell you how they help. Absolutely amazing. You know when you need them again. Your body and mind tells you. You want to run to the doctor immediately. It's so helpful, so much better than pills. That's why I tell every single, I mean, veteran especially, but that's why I tell everyone that is using medication, please, please, if you absolutely have to use medication, then that's what you have to do. But the medication does not go nearly as far as other options such as this. All right, well, that's going to go ahead and wrap things up here today, guys. Thank you so much for watching. Hopefully, this helped you out. If it did, please like, share, and subscribe. I would love to have you guys join the family. And so, we are on a journey to change society for the better, to really, really help people, regardless of where you come from or who you are. And so, if you ever need me for anything, please reach out. I'm always here. I'm always here. I have an open door policy, and I seriously believe in that. That being said, guys, please take care of yourselves, both mind and body. I love you all, and I appreciate every single one of you. Wish you all a lovely day, and I'll talk to you guys soon.